All right, welcome back. I'm Michael Stamatinos, your host for the Advancing Healthcare Innovation Show. And if you're new to us, we're super excited to have you here. We also happen to be crazy passionate around healthcare innovation, adoption, things that increase access, drive leadership. If this is your first time tuning in, let me tell you a little bit about what we do here. So we're a healthcare innovation company. We're focusing on bringing on real stories of innovation to life. Our aim is about highlighting real people that are in the trenches, that are truly innovating within our space, and in essence, giving them a platform to share their stories with the world. We've got an incredibly action-packed year. If you haven't checked out any of the historical interviews that we've done, do so now. So hit subscribe wherever you're at right now, and you'll get the new content right into your inbox. As noted, super excited and delighted to have our next guest on, Padma Sastry, Senior Director, Digital Transformation at Lowell Community Health Center. Padma, welcome to the show.
Thank you. So great to be here.
Yeah, I'm so super happy and excited to chat with you today. So maybe before we get rolling along, because I know you have a track record of innovating within healthcare, what really drew you towards the underserved and overlooked population that you guys are really taking care of now?
So I want to just go way back to the origin story, if you will.
Yes.
I am a clinician by education, so my focus has always been on kind of the patient. And I always wanted to be, front and center in terms of how best can healthcare make an impact. So patients are, they deserve the best. And while I was completing my grad school in University of Massachusetts Lowell, I had the opportunity to do the internship at a place where I work right now, which is Lowell Community Health Center, and a very, very interesting project that I worked with the team at that time. So grateful for such opportunities for students that are trying to get into healthcare and such. So that kind of put me in the mindset of, okay, always asking, with this complex healthcare system, like, how do people actually navigate these? And what do you do when you don't have all the resources, or you don't speak the language, or you have other limitations? How do you navigate it? And what is access truly for these populations? And how do we have to kind of make it more seamless for this population? Because when they grow, the entire community grows.
That's right. So there's a myth that's out there, and it kind of goes like this, that when you're serving certain populations, it's tough to innovate because of the lack of resources. And what I want to really sort of demystify today is how you and your team, how you've innovated despite not having a ton of resources, how you've been able to sort of innovate within those constraints. And maybe we can kind of take a step back, talk to us and share a little bit about Lowell Community Health Center, the type of populations that you serve. I think we can kind of start there and talk about maybe some of the constraints that you're currently dealing with.
Sure. So Lowell Community Health Center, we're a federally qualified health center. We've been here many, many years, serving the underserved and the overlooked, if you will. We provide health services, and not just healthcare, but holistic services. We have primary care, which is the main source of our healthcare services. Behavioral health services, eye care, dental, one-stop shop for anybody who walks in, irrespective of their ability to pay or not. We never turn anybody away. So we basically onboard patients who not just, want to just get general health care, but also kind of, behavioral health services, somebody who needs just, food, housing, any kind of assistance with their social determinants of health, because we see that as kind of so very interconnected. So that's the work we do. 40% of our population or so, they speak a language other than English as the primary language. So we do serve a lot of people who don't speak English. So we do have a lot of emphasis on, okay, when it comes to access, that access should be equitable, and then, the way you speak the language is the way you understand it, the way you comprehend it, the way you understand and how your outcomes, your health outcomes are driven. So we work very closely with all of the underserved population in the community, along with our partners in the community. Our biggest challenges, as pretty much everybody, was during the pandemic hit, where there was just this huge need of patients wanting to come to us, and we want to be able to keep our doors open, which we in fact did. When everybody else around us were at capacity, and when everybody was like, "No, please don't come to us," we said, "Come to us, and we will help you." And so with that, I think we sort of became the hub in the city of Lowell for all of our patients to say, okay, let's go to this health center, whether it's for their regular care or during the vaccine administration period, where we would be just there for them to say, and explaining the ability for them to schedule appointments. And as you know, with so much of that demand during the vaccination phase, where it was so hard for some of the underserved people and who just couldn't navigate their way to find a place where they get vaccinated, don't speak the language, just didn't know how to do this. So we gave them some resources to do that. So that's what Lowell Community does. So to answer your question about the how do we demystify that? So I feel innovation is sort of, I like a term that's always used, and people have this picture of it happens in these really sophisticated research institutes and labs where people with like huge think tanks sit together and they drive out this big ideas, and then it gets rolled out. I feel that community health centers have been innovating for a very, very long time. And I'll tell you why.
Yes.
It's because there is a need, and the need makes us, innovate. There's a need, and that has to be the one that's the driving force for anybody to innovate. For example, I mentioned that a lot of our patients don't speak English as their primary language. Can they function without knowing the language? Yes. Are they comfortable in speaking in other languages, in English? Not necessarily. When the pandemic hit, when everybody said, okay, let's just go over to virtual care, telehealth, and then everybody said, oh, this is how we're going to be performing care for all patients, regardless who you are. It was a broad thing. And then that became the model of care at that time. We soon realized that our patients do not have cell phones. Our patients do not know how to use any application on the phone, download, figure out all of the nuances. They don't have high-speed internet. And even after we give them all of these facilities, they do not know how to navigate in order to, in terms of language. So that was truly like out there for us to say, now solve this issue for us. And that's where you come to innovate and say, how do you make this all work? And that's kind of an example that I would give you, that we have figured out how do we make language access kind of front and center for how we deliver care. No matter where our patients go, we want to be able to give them interpreter services and an ability for them to convey the message to us in the language that they're most comfortable in. So that's one example that I can give you, that innovation truly happens in these environments where the need kind of prompts you to start thinking about, now how do we problem solve this?
Well, let's frame that up a little bit, because you're right in the sense that the population that you're serving, yeah, they might have a smartphone, but they don't necessarily use it to the extent that maybe some of the other general population uses it. So when you're asking them to download another app, I mean, I think even the general population, that there's a lot of let's just call it overdosing on apps. I don't know if that's a term, but there's a lot of apps. Okay, they're apped out. How do you sort of explain this to someone that doesn't speak the language? In what ways have you been able to meet them on their journey, provide them the information, and give them that access? Can you give sort of a concrete example of what that looks like when it's in action?
Yes. one of the examples I would like to share is kind of when it comes to outreaching to our patients, we realize that different people digest information differently. You might want to receive everything via text. Somebody else might want to pick up the phone and call us. Somebody wants to face-to-face conversation, and realize all of those things, that one size does not fit all. Now to that, you have to add all of the languages that we have to speak in. Our top 5 languages are English, Spanish, Portuguese, and Khmer, because we have a lot of Cambodian population. Second to the hub in Los Angeles, Lowell is the onboarding space where we have a lot of Cambodian population. So it's that very specific language. So we have to make sure that when sending out, using digital engagement, when we send out a text message, that it has to be in simple spoken language, and then it has to be in their language of their choice of what they prefer to use. So we partnered with Notable Health, which is a digital engagement platform, and they were able to design a platform for us where any kind of information that we want to convey via text can be sent in all the languages. It's natural language processing. In addition to that, there are certain things that, during the course of the pandemic or even beyond that, patients are not necessarily comfortable sharing that information with a person when they're just put on the spot and asked those questions.
Yeah.
Some of those are very certain private things that they won't necessarily feel comfortable asking. And there's a lot of cultural components to that too. We have a huge refugee population that we onboard. So there's now add a layer of culture, and then, how do you want to assimilate that into the population? So we realized that that particular subset of population are comfortable reading that information on their digital phone or whatever it is, where we that provided them with a device that they could read it. And it's a simple binary yes, no type of a response. That response is so important to us because we can action certain things based on the response. And by looking at our data, we were getting a lot more responses that way than we ever did before. So those are
did it surprise you about the level of engagement that occurred within this population? I mean, when you're talking about engagement, can you throw out some statistics in terms of the level of responses when you are doing things like SMS and things of that nature?
Yes. So when we rolled this out initially, we sort of expected that nobody's going to be jumping out and saying, okay, let's do it this way. It would have to go through its own evolutionary process.
Yeah.
Right.
Sure.
We have to empower our patients to say, now this is the means that you can access us in many ways instead of just having to call us. So do you still have the ability to call us? Yes, you do. However, this is another way. When I mentioned that there were so many cultural aspects to this, that is kind of one of the key aspects that I will throw out there. That is a learning that we have discovered. There are certain pockets of population that are somehow just very shy of using technology, and very shy, or they're just very uncomfortable with being approached suddenly with text message or something to say, now say yes or no to this, for a variety of reasons, and we respect that. For that very reason, we saw a huge utilization, like around, and I'm putting this very generously, around 50% of, like, say, English speaking, who have all the tools to speak the language, they are obviously very easy, and then, to engage and everything. They will ask us questions and they're done. But the rest of the population they ask you questions. Why are you asking me this information? What is the purpose of this? Why do you need this information? Are you going to share this with somebody? So there's a lot of hesitation around it, which we totally understand. And that is where we kind of engage our community leaders, our community health workers, our interpreters to kind of, explain it, kind of.
And how big is that team that you have, community health workers and such?
At that time, it was not a very big team. Okay. I would say maybe at that time, it was probably, not sure, around 4 to 5 people. Okay. but most of it was through whether our call center and then uh, just us in the technology team
Yeah.
trying to figure out how do we get a hold of them. And the data really helped us. The other thing that I forgot to mention earlier is the need for providing this in the language that they needed, is because when we initially just sent out text messages, and if you know how text messages, like when you get a reminder, say, hey, here's your appointment,
Yep.
cancel, or
Reschedule.
schedule. So it was in English, right? So the thing that they read was, what is this? And then they can't read that. Even some people who speak English cannot read English. So that's something that we also have to remember. So they see this and they click cancel because they cannot read it. So that's another kind of a learning that we have to say, okay, now we have to figure out a way to make it color coded. We have to, instead of just giving them 2 boxes, make a happy face, a sad face, something like that. So that it's not great innovation, but it's improvising.
Well, it sounds like what you're doing is it's sort of step function improvements. You're creating these little experiments. You're getting information back. You make improvements, and it's sort of a tight feedback loop. How long do you normally experiment? The duration of this is, you're talking a couple weeks, a couple months?
It's an ongoing cycle. We plan to study and act constantly because our patients' needs remain the same, the demand is the same, and operations remain the same. And if there's anything, we have to kind of up our game. And then from there, we have to come up with more innovative solutions. So it's an ongoing process.
What are some things that you guys have deployed that have surprised you, in the sense that maybe you thought it was going to go one way, didn't necessarily go the way that you initially planned? And any of those learnings that maybe I'll call them even embarrassing moments, that you're willing to share?
So I want to share one example where initially when we thought that, let's give everybody a cell phone. So we came up with a cell phone program. And this was the beginning of the pandemic. We're like, oh, let's get them really nice iPhones. And
Wow, that's very generous of you.
so we partnered with T-Mobile, and we were like, oh, this is going to be great. And then we gave them the iPhones. And suddenly, these cell phones started to get legs and started to walk around wherever they were. And then we were like, oh, what's happening to these phones? And they were disappearing, and we've been finding them not being in use. And sometimes we try to call where it is. We would find them somewhere in Boston, and we soon realized maybe this wasn't the right method for this communication.
How many phones did you end up giving away?
Yeah, and we have a lot of substance abuse and all of that prevalent in our community, and there was a concern that people will use this really expensive phone to exchange it, or sell it, and it has happened. And so we were like, oh, we should have thought about this a little bit more, and we would give them something that that they feel like it's explaining to them what they use it for, setting the right expectations. But then you can't control what they do with a device as such.
Yeah, that's an example of what I would call an expensive experience. And when you think about, hey, we're solving this problem, they now have this phone. And the truth of the matter is that there are other social determinants that are impacting them. Maybe they don't have food, and they view that phone as a means of being able to exchange it for food for the next couple of weeks. And who
Exactly.
would have thought that?
Exactly. And the fact of the matter is they're both positives and kind of the other aspect to it. The positive being, we've been trying to get a hold of a patient. The patient cannot be found. We have a lot of homeless population that move around.
Right.
In that particular use case, we said that we're having trouble getting a hold of you. How would you like to be approached? And they're like, well, if I had a phone, I think maybe that would be a better way. And this person was definitely in the need of some constant monitoring because, they were in the program. We didn't expect that this was going to be sustainable, but we gave him a phone anyway. And from that point, things started to turn, and he was compliant with the program, sober for months, and we were like, wow, So we do have to experiment it with kind of that, that positive mindset to think, let's see what happens and let's see what we learn from it. So if it works, it's great, and we will impact the patient's life and their health outcomes. If it doesn't, we'll learn from it.
Is that a corporate culture that allows the folks at Lowell Community Health Center to be able to take risks per se, and then to learn from them and to move on? I guess is that something that has been instilled through the staff?
Right. The health center itself is very committed to serving the community. So along with that, we are very, upfront about how we would like to make our patients feel about accessing health through our health center. So yes, that's definitely a top-down, down-up kind of an approach that if there is a patient in need, we want to make sure that we help them in any way we can. And in my area, which happens to be technology and analytics and all of that,
Yeah.
I feel like my impact would be, or within my scope would be through technology and through innovating through technology and overall bringing about digital transformation.
So when you think about digital transformation and technology, and you think about some of the financial constraints that you guys are under, what have been some creative ways that have allowed you to bring in some of this tech? How have you been able to fund some of this tech? Because clearly, there are some that will give it out of the goodness of their heart, and there are others that just aren't able to do that. How have you guys been able to fund some of these projects that you've taken from the ground up and been so successful with?
Yeah, I'll give you one example, and I have to give this kind of kudos to my team for figuring this out. And like I said, it's always a PDSA cycle, so we're always trying to figure it out because we know that we don't have infinite funds, and we always do big things with very little. When we started to look at some of the data, and that's why I feel data is the one that is going to kind of manifest itself and show us the way. We realized that we were spending a lot of, money on our third-party integration services, which, it's kind of a corporate kind of third-party kind of thing. And we have in-house interpreters. And we realized that because of a very complex way of how we were organized and set up, our providers were just leaning towards a third party because it was just easy. Just, dial the number, pick up the phone. And it was like a multiple step process to reach our internal interpreters. So we basically decided to come up with an easy way to say, in our voice, our phone system created a little phone tree and said Spanish, Portuguese, come on, English, and as a phone tree. And who would have known that setting up something like this, and we have them set up first, and if they cannot be, they're busy, then they go to the third party phone line. So naturally, because of the ease of use and that experience, our providers started to use our in-house interpreters more because we wanted to make sure that the knowledge base and our interpreters are truly magnificent in terms of just not just doing translation, but understanding where they're coming from. We hire from within the community so they kind of understand the culture. So
Yes.
that is amazing to retain and leverage versus a third party that's strictly transactional. So that would be, and as a result, we had huge savings in our third party utilization and huge patient satisfaction because they had this personable one-on-one kind of interaction with our interpreters and the providers, which, it says for itself.
Yeah, what you described there is what I would call a 2 millimeter shift. Shifting something a couple millimeters, and yet it provides profound breakthroughs.
Exactly. And that's what I say, that innovation doesn't have to be this big bang, somewhere where this huge thing happens. It can be really small, but that has huge impact.
So what you just described there, you have a third party interpreter service. When do you decide internally that you have to either use internal resources for something or go externally to get an innovation from the outside and bring it in? I mean, you mentioned a tech company, but how do you kind of walk us through what your process is when you're either evaluating problems? Like, for example, I mean, are there priority issues that you're thinking about now in the next 6 months, the next 12 months? And then kind of maybe walk us through your process of, all right, what can we handle ourselves internally, whether it's through a slight 2 millimeter shift, kind of like what you just alluded to, and then going to, all right, maybe we need to go to the outside and bring something in. Like, what? Take us through that matrix of decision making.
Sure. Any problem solving that we're trying to do, whether it's operational or strategic, right? Um, there's definitely a comfort in using internal resources, internal processes. And because we are so like integrated within the community, we want to make sure that we provide that personable thing. But we know we don't have all of the answers to every single problem there is. And
Yeah.
there's definitely merit in reaching out outside those four walls and bringing that expertise in-house, because more brains, more ideas, and at the end of the day, we want it to benefit our patients. And if we and when it comes to just the operational tactical tasks that our staff have to do, we realize that we may not have the we may never have that many staff that we want to. We always have to make do with little. So sometimes when it comes to, from my area, like around, digital transformation or such, or automating certain things, we want to make sure our staff are working at the top of their licenses and are doing value-based tasks rather than the repetitive kind of, the menial things that sometimes, you don't have a way out, but needs to get done. But we want to make sure our staff are actually working on the things that they're passionate about.
That's right.
And then we want to bring in the area where, we either automate those or we bring in somebody to say, okay, so how can we do this? So that's how we evaluate. My goal generally is to try to walk away from anything that's manual, tedious, adds time to our staff, and it doesn't add any value. And at the end of the day, nobody's benefiting from it. Now you flip that around, make things automated, make this more streamlined, and everybody's benefiting from it.
Okay. So that's sort of your thought process then, is things that are repetitive and doable, that that don't need to be, time needs to be taken by a registered nurse to do certain things. And you feel like those are, then you kind of place those into a bucket. Then it sounds like you kind of prioritize those and saying, all right, what can we first automate? How can we make this more streamlined? So it seems as though what you're also doing is taking more of a human-centered design approach. So you're going in there, you're observing workflows, and you're doing more of the nitty-gritty assessments. And then you're taking back to you and your team, and then you're kind of just dissecting and problem solving from there on out.
Yes, absolutely. Any project that my team goes into, we first start with a gap analysis. How are we doing this like today, and what are some gaps? And then we try to like figure out, okay, what is the best course of action? And what are we following? What is the trail that we are following? And what do we want to see as an end result? My staff's voice and my staff's engagement is very important, and we work very collaboratively together. So all those ideas matter. And then at the end of the day, because some of our staff are our patients, they tell us that, when you guys did this, we would have expected to something else, but that was an answer that's right in front of you that you can easily do.
So when you're doing these focus groups, these team meetings, talk about the stakeholders that are involved in these meetings. How big is your team, and share a little bit of line of sight into that.
I want to say, because we're community health centers, we're smaller groups. We're not, the Mayo Clinic. We're really small, but we're very engaged, kind of a tight-knit group. And we're very fortunate to have an exec team that truly believes that the patient comes first, and things need to be equitable, and we need to serve our community. My team is generally I oversee both technology and the applications team, analytics, and medical records. So when we we always start small, a small brainstorming. All ideas are on the table, put them all, and then I try to keep away from just talking about problems, rather than here's a problem, oh, here's a solution. Here's the problem, and oh, here's a solution, just in that sequence. Because what happens that when we all sit together, a group of us, and we usually talk about, oh, here's this problem that we want to solve. But then it shouldn't end up being a venting session on, oh, this problem, and we're not getting anywhere with it. So we want to focus on solutions. So you have to be intentional in terms of when you outline a problem, that is followed by a solution. It doesn't have to be the final solution, but it is a solution. So that's the kind of process we use.
So then it sounds like then not expending energy on just like you mentioned, just a session of just venting frustration. There's a time and a place for that, as long as it's followed by, okay, how do we attack this? How do we make it better? So there's always sort of a consequence of venting out and airing your frustrations that's always coupled with, let's see what we can do about it. I mean, these are very basic, simple things, and yet it just seems as though you have more of a very clear, focused discipline on doing this.
Yeah, and sometimes there's going to be competing priorities. All of us have those. We had to replace our entire electronic medical record. We went live with Epic December 1st. So that became front and center of pretty much everything. Was like life-changing, ginormous project, while everything else is going. So the reason why I feel like these things, like you said, there's a time and place for that. Just like that, there's going to be competing priorities. So we have that flexibility, we have that grit and that agility to pivot. And community health centers, historically, whether it's through need or whatever circumstances, be experts of pivoting, because there's always that need that we have to jump on it. So you pivot, you focus, and you action it. And sometimes there is this very disciplined and straightforward approach to things, and sometimes it's chaotic, but there's a pattern that will emerge from it. But at the end of the day, we get something done.
So at the time of this conversation, where we are within the year, what is it that you're most excited about coming up?
Like I said, because we were in the midst of implementing a new EMR, it was huge in terms of change management. I'm really looking forward to all of the pieces coming together. We're right now in a very kind of like, post go live. We're trying to stabilize things. My team is now focused on making sure our providers, our doctors, our nurses, all of our staff, clinical, non-clinical support staff, are all able to kind of, come up, dust off from all of the, the stuff that happens with any new implementation, and get into a stable kind of a phase. And from there, we optimize. And from there, we like operations never stops. We always have to keep the lights on. But while there's always this break fix type of a mindset that happens, there always has to be a small core team that's very much focused on moving the organization forward. And we're very grateful for our for our chief strategy officers, also our chief finance officer. So she kind of understands kind of like big picture and is very experienced in terms of, okay, what's our North Star? So while we still have all of these day-to-day things to go through, we're always focused on that North Star. So I'm excited for that, for our strategic vision and our vision of, again, revamping our telehealth program and making access more sustainable for our patients.
It's very exciting. And to make a comment around what you mentioned about having a small team, that actually sometimes is a benefit. when you get into these large committee meetings, you're talking dozen or so people more, I tend to find that things don't move along as quickly. I can't really put my finger on what the magic number is, but I can say that when it's like six or less that are on a task force,
Yeah.
it's not easy to hide. So you have accountability there,
Oh,
and
yeah,
you can move a
definitely.
little bit more efficiently. So I would say that you might be better off in the sense that you have smaller teams. Maybe it's a hidden blessing for you all to have a smaller team where you can be nimble. And you mentioned pivot, and you don't necessarily think about being nimble and pivoting when it comes to healthcare institutions. Let's just be frank. When you think about pivoting and agile, you think of that more synonymous with earlier stage digital health companies or healthcare companies that are really startups in nature. It just seems as though that you've taken that approach and you've applied it to to this to this environment, and it's actually very refreshing to hear it, seeing how you all have been able to generate, you know, innovation on a larger scale. That's very, very cool. So I just want to commend you and just say thanks for doing what you're doing. And for those that are tuning in, is there a way that they can follow your work or follow the Lowell Community Health Center? What's the best way for folks to kind of keep tabs on you and what your team are doing?
Sure, that's a great question. I'm on LinkedIn. You can find me on LinkedIn. Lowell Community Health Center is on LinkedIn, and we're on social media. Definitely go to our website, lchealth.org, and take a look at some of the work that we're doing. We have all of our strategic vision as well as our equity scorecard over there. So feel free to take a peek and definitely give us your feedback.
Amazing. So again, thank you for carving out time in your pretty hectic schedule post go live to do this. And for those that are tuning in, if you found this content helpful for you, would you mind liking it, sharing it on social media, maybe even commenting on maybe one of the biggest takeaways that you found from this conversation? I have a list of golden nuggets that you have shared with us today, Padma, but I'm very grateful when you have folks like you that come on that are incredibly passionate about access and care and creating and making a difference in the community where you're at. I think that's really where it starts. You don't need to want to change healthcare globally. It's like, no, change healthcare where you are. And sometimes that might just be in your community. So when we get more innovators and more doers together, making stuff happen, it's super exciting. So I'm looking forward to having you come back onto the show, open invite, and maybe we can have a version 2.0 of this and let us know about some of the other learnings that you have going on. So thank you so much.
Thank you.